Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cholecystectomy, laparoscopic, discharge instructions, introduction. You had a laparoscopic cholecystectomy. This is a procedure that removes the gallbladder through several small incisions in your abdomen. A laparoscopic cholecystectomy may be done if you have gallstones or if your gallbladder is not working normally. Discharge instructions are specific directions for you to follow when you go home. The following discharge instructions will help you learn how to take care of yourself at home and when to call your healthcare provider. Ask your healthcare provider if you have any questions about your discharge instructions. Make sure that your health information and self-care instructions are shared with your primary healthcare provider. Incisions. You will have one or more small incisions after a laparoscopic cholecystectomy. These incisions may or may not be covered with dressings. You can remove dressings 24 to 48 hours after the surgery. Keep the incision areas clean by gently washing them with mild soap and water. You may take showers 24 to 48 hours after a laparoscopic cholecystectomy. Pat the incision areas dry after a shower. During surgery, your incisions may have been closed with glue, steri-strips, stitches, or staples. If glue or steri-strips were used to close your skin, do not try to remove them. Let them fall off on their own. This usually happens within 10 days. If your incisions were closed with stitches or staples, the incisions should be kept dry until they are taken out by your healthcare team. This is usually within 7 to 10 days. You may place an ice pack on the incision areas for the first few days after surgery. This can help reduce swelling and pain. To prevent pain, hold a pillow against the incisions when you laugh or cough. You should also hold a pillow against the incisions when you get up from a lying or sitting position. Activity. Your healthcare provider may limit your activity after a laparoscopic cholecystectomy. These limits can last for a few days. It may take a day for the full effects of the sedative used during the procedure to wear off. Rest and relax at home. Slowly increase your daily activities while you recover. Ask your healthcare provider when you can return to school or work. You may feel weak or tired after the operation, but it is important for you to walk. This helps prevent fluid buildup in the lungs. It also prevents blood clots in the veins of the legs and pelvis. Blood clots can move to the lungs and cause death. Avoid sitting for long periods of time. When you sit, prop your legs up to help prevent blood clots from forming. Do not drive while taking strong pain medication. Your healthcare provider will tell you when you can start driving. Don't take a bath or use a hot tub for at least 1 to 2 weeks. Do not go swimming until your healthcare provider says it is okay. Stop smoking if you smoke. Smoking makes it harder for your body to heal. Talk to your healthcare provider if you need help quitting. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diet. You may feel weak or nauseous after the procedure. Eat small meals frequently. This can help prevent nausea. Choose soft foods that are easy to digest. Soups may also help settle your stomach. Drinking a lot of water and other fluids can help prevent dehydration. Constipation is common after surgery. Take a stool softener as needed for the next 30 days. Eating foods that are high in fiber and drinking plenty of water can also help prevent constipation. Medications. Your healthcare team will give you specific instructions about how to take your medications. Take prescribed medications as directed by your healthcare provider. Ask your healthcare provider how often and for how long you should take each of the medications they prescribe. Make sure you understand the reason for taking the medications and their possible side effects. Check with your healthcare provider to see if there are medications you need to avoid. Tell your healthcare provider which medications you normally take and ask which ones should be continued when you are discharged. If some of your medications had to be stopped, ask when you can start taking them again. This is especially relevant for blood thinners. When to call your healthcare provider. Some symptoms are normal after a laparoscopic cholecystectomy. For example, you may have some bruising near the incision areas or mild pain in your abdomen or shoulders. You may also feel nauseous. Notify your healthcare provider right away if you experience a cough that does not go away, difficulty eating or drinking, gray or pale-colored stools, yellowing of the skin or eyes. Contact your healthcare provider right away if you develop a fever higher than 100.4 degrees Fahrenheit, 38 degrees Celsius, chills, redness or swelling around the incision, severe abdominal bloating or pain, dizziness. See your healthcare provider if you had an IV placed in your arm and you notice signs of an infection where the needle was inserted. These include bleeding or drainage, pain, redness, swelling. Call your healthcare provider right away if you have constant nausea or vomiting, difficulty urinating, drainage or bleeding from an incision, redness or swelling around the incision area, separation of an incision. You should also contact your healthcare provider if you experience symptoms of a blood clot in the legs. These include chest pain, leg pain, shortness of breath or breathing problems, swelling in your arm or leg. Contact your healthcare provider if you have any questions or concerns about your discharge instructions.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Follow-up. Go to all of your scheduled follow-up appointments. Call your healthcare provider if you need to set up the appointment. During the follow-up visit, your healthcare team will make sure that there are no complications and that you are recovering as expected. Thank you for using Explain.